Hi, I'm Dr. Michael Rich, a pediatrician at Boston Children's Hospital. As pediatricians, we are looked to as valued advisors on a wide variety of issues affecting children's health and development. Since media from TV to cell phones to the internet have become a part of nearly every aspect of our lives, the media children use and how they use them has increasingly become an area of concern for families. But we physicians have little training on how to talk to patients and parents about how media use may affect their health. Research has shown that media can affect many aspects of a child's health and well-being, including how they manage their time, how they eat, their physical activity, their academic and social emotional growth, and whether they engage in health risk behaviors such as violence, unsafe sex, and substance use. Because media can affect a child's health in so many ways, and because you have only a brief amount of time with your patients during wellness visits, the Center on Media and Child Health at Boston Children's Hospital created questionnaires to be completed by children and parents in the waiting room that can help you assess and address media-related health issues about which your patients may be concerned. Designed to be given to patients and their parents when they first check in for their appointments, these questionnaires are a series of yes-no questions that take no more than 5 minutes to complete. Collect the questionnaires when you greet your patient and parent. You will notice that the provider key instantly shows you the patient's and parent's areas of concern, which can be different, so be sure to address each. In this case, Kevin and his mother Jane both have concerns about school performance. So I see here that you both have some concerns about school. Kevin, can you tell me what you're worried about school?
I like school and all, but I'm drifting off in classes, and I even fell asleep in math, and I really like math.
Yeah, actually his math teacher called me the other day after he dozed off in math, and she's quite concerned about him missing out on important material. And I also noticed that when he comes home from school, he's pretty tired, and he has a hard time doing his homework, or doing it really well as he usually does.
Kevin, what time do you go to bed?
I don't know, 9:30?
And do you go right to sleep?
No, I brush my teeth, I get into bed, I read on my tablet for a bit, and I talk to a few friends.
How bright is your tablet?
Pretty bright, I read in the dark.
And you talk to friends at the same time?
No, they text me and I text them back.
And actually he plugs in his phone beside his bed. He uses it as an alarm clock.
Okay. I have a few suggestions that may help alleviate some of Kevin's fatigue so he can stay awake during class and focus better on his homework. You're a curious guy, so you'd be interested to know that we human beings are programmed to be active and alert during the daytime when the bright blue light of the sun is on us. And then when it gets dark, we get tired and curl up and go to sleep and rest up for the next day. Interestingly, your tablet puts out the same kind of blue light as the sunlight, so when you are reading on it, it's keeping you alert and awake. Kevin, it's awesome that you read before bedtime, but you may want to switch to regular old print books because, interestingly, the blue light emitted by your tablet may be triggering you to stay alert and sleep less soundly. And get a regular old alarm clock to wake up in the morning. Charge your phone in your mom's room. Waiting for text messages may be causing you to stay up later so you can be part of this conversation.
But what if I miss an interesting text?
Let your friends know that they can text you anytime up until 8, but your family goes offline after that. Anything really interesting will still be interesting in the morning.
So should we stop buying ebooks for Kevin's tablet?
Well, Kevin is such a curious, smart guy that he'd be carrying around a library if he were carrying around the number of books he could keep on his ebook. But I would suggest going to a print book or to an e-reader that doesn't emit light for an hour before bedtime.
Okay, sounds good.
Do I have to give up my phone?
Just give it a shot and see how you do. If you're still tired after a few weeks of not using your phone or tablet after 8, come on back and we'll see if we can find some other solutions.
Okay, but I'm going to blame this on my mom.
Okay, by me. Thank you, Dr. Rich.
Here's a tip sheet on some of the things you can do in terms of media use to help him improve his school performance, get better rest, etc.
Okay, that's great. Thank you very much.
You're welcome. Of course, you can tailor these conversations to your patient's concerns in your own clinical style. For additional information on how to talk about issues of various health effects of media use, please visit cmch.tv/clinicians. There you'll find detailed instructions on how to use the media history questionnaires and tip sheets on media-related health issues. Download and print them as you need them. Please email any questions or suggestions you have to cmch@childrens.harvard.edu. Thanks for your time and attention. Together, we can help children use media in healthy, safe, and productive ways.